Welcome, curious minds, to another deep dive.
Hmm.
Today, we're plunging into something so fundamental, we rarely give it a second thought. Water.
Right. Seems simple enough.
Exactly. You might be asking, what's so profound about H2O? Well, when it comes to a specific and surprisingly dangerous condition called swine salt toxicity, the seemingly simple element holds a really counterintuitive twist.
It really does.
Okay, let's unpack this. Our sources reveal that this isn't primarily about pigs eating too much salt. It's crucially about them not having enough water. It's almost the opposite of what you'd expect, isn't it?
Totally.
Our mission for this deep dive is to extract the most important insights in the material you've provided, quickly getting you well informed on this critical issue in swine health. You'll truly understand its surprising causes, the dramatic signs it presents, and what really makes it so devastating.
It's a fascinating area, yeah.
Yeah.
Especially how something as basic as, consistent water access can have such catastrophic outcomes. We're talking about a potentially fatal neurological condition
Fatal, yeah.
that can lead to significant economic losses for producers. Understanding this balance is absolutely vital.
That balance is indeed key. Pigs, surprisingly, can tolerate quite high levels of salt in their diet. Standard rations, for example, typically contain about 0.4% to 0.6% salt, which, by the way, is essential for their normal bodily functions, like nutrient absorption.
They need some salt.
But here's where it gets really interesting and quite dangerous, that tolerance only holds if they have unrestricted access to fresh water. It's a delicate seesaw.
Precisely. The moment that seesaw tips, things can go south very quickly. What we call swine salt toxicity, or more technically water deprivation sodium ion toxicosis, actually occurs in two main ways.
Okay.
The first is direct salt poisoning. Now, this is less common, but it's when pigs truly ingest an excessive amount of salt. Think like salty brine or whey, or even feed that's been improperly mixed with way too much salt.
Right.
This is especially problematic if their water access is also limited at the same time.
So maybe if they accidentally got into a massive pyre of something incredibly salty
Yeah.
and couldn't drink enough.
Like a double whammy.
Exactly. But the second scenario, which is by far the most frequent cause, is indirect salt poisoning. And it's essentially a water deprivation issue.
Okay. That's the main one.
Yeah, this happens when pigs are consuming a diet with perfectly normal, even ideal, salt levels, but their water supply is cut off or severely restricted. And what's crucial to grasp here is that toxicity can develop within as little as 48 hours of water deprivation,
Wow.
even if the dietary salt levels haven't changed at all.
48 hours. That's an incredibly short window. What are some of the most common real-world scenarios that lead to this kind of water deprivation on a farm? It can't always be a big accident, right? It must be smaller things.
You're right. Often it's a series of small, easily overlooked things. Mechanical failure of waters, like blocked nipples or pipes, that's a big one. Catches people off guard.
I could see that happening easily. Frozen water lines during cold weather are another frequent culprit, sadly common in some climates. We also see issues with overcrowding, where intense competition for drinkers means some pigs simply don't get enough.
Sure. The ones lower down the pecking order.
Exactly. Or sometimes the water itself becomes unpalatable, maybe due to contamination or just an odd taste, and pigs just refuse to drink it.
Huh. Never thought of that.
And yeah, sometimes it's simple oversight, like forgetting to turn on the water supply to a new pen happens. Prolonged transport without access to water is another significant risk factor too. Can lead to rapid dehydration.
It sounds like it's often about the daily grind and just
Yeah,
the challenges of keeping everything running perfectly on a farm.
pretty much. Diligence is key.
Now, let's dig into what happens inside the pig's body. So, what does this all mean for the pig's brain when this critical saltwater imbalance occurs? What's the mechanism?
This is where the true and, well, rather fascinating danger lies. The progression to severe neurological disease is due to dramatic osmotic changes within the brain, essentially. Shifts in fluid balance. It's kind of a three-step process.
Okay.
First, without sufficient water, sodium levels in the blood begin to rise. We call this hypernatremia, just means too much sodium in the blood.
Right.
The brain cells, sort of in an attempt to balance things out, start to accumulate sodium ions as well. They try to match the blood.
So the brain is essentially trying to hold on to sodium to match the rising levels in the blood, kind of equilibrating.
In a way, yes, exactly. And that sets the stage for the most critical danger. The second step, this is where the most severe and often fatal damage occurs. This is the critical danger point. Rapid rehydration, leading to something called cerebral edema, brain swelling.
Oh.
So when a pig that has been slowly dehydrating suddenly gets unrestricted access to water, maybe the farmer fixes the pipe.
Yeah, you find the problem and turn the water back on full blast.
Right. That water is rapidly absorbed into the bloodstream, quickly lowering the serum sodium concentration. But here's the kicker. The sodium concentration in the brain, which built up slowly, remains high.
Can't adjust that quickly.
Precisely. This creates a powerful osmotic gradient, basically, a huge imbalance in salt concentration between the blood and the brain cells. And that pulls water directly into the brain cells. They swell up.
Oh, wow. So the most natural human instincts, they're thirsty, give them water, is precisely what turns this from bad to catastrophic. That's truly counterintuitive.
It is, isn't it? And it's a stark reminder that sometimes the seemingly obvious solution is actually the deadliest one in these situations.
Yeah.
And that swelling leads to the third step, neurological damage. The swollen brain is constrained by the rigid skull, right? There's no room to expand.
Right, it's closed box.
So you get increased intracranial pressure, and that causes all those characteristic dramatic neurological signs we see with the disease.
Understanding that internal chaos really helps us recognize the external chaos. So what does a pig look like when it's going through this? What should a producer be looking for out in the pen?
Well, the clinical signs are primarily neurological, and they can progress very rapidly. Affects pigs of all ages. Early on, you might notice increased thirst, constipation, and sometimes even extreme itching, almost like they're restless or agitating.
Oh.
Yeah, pruritus. Pigs might appear frantic, trying unsuccessfully to drink from waters that aren't working. But a crucial, often overlooked early indicator is a sudden loss of appetite. Inappetence.
Okay.
If an entire pen of pigs is suddenly off feed, the very first thing you should do is check their water supply immediately. Like, drop everything and check the water. It's your top priority.
That's an incredibly practical tip. So if they're not eating, check the water.
Got it. And then what happens as it progresses, when it gets worse?
As that brain swelling, the cerebral edema develops, pigs become largely oblivious to their surroundings. They'll start aimlessly wandering, bumping into objects.
And may appear blind and deaf. Head pressing against walls or other objects is a classic sign. So is circling or sort of pivoting around a single limb, you'll see them acting quite disoriented out of it.
And what about those characteristic seizures that often accompany this? You hear about those.
Yes, the most distinctive and often frightening signs appear as the condition worsens, frequently in sort of intermittent episodes. Pigs might assume a unique dog-sitting posture, almost hunched up.
Right.
You might observe a rapid twitching of the snout, which often happens right before a full convulsion. Their head can be suddenly jerked upward and backward. That's called opisthotonos.
Okay.
Then they often fall onto their side, experiencing rigid tonic-clonic seizures with their limbs paddling wildly. These are the classic full-body convulsions, alternating between stiffening and jerking movements.
Sounds awful.
It is. Affected pigs often go into a coma and can die within just a few hours, or maybe up to 2 days. Mortality rates are unfortunately high, often exceeding 50% even if you try to treat them.
Wow, that's incredibly grim. Is there anything at all that helps differentiate this from other conditions that might cause similar neurological signs? It sounds like there could be a lot of overlap.
There can be, absolutely, but there's a really important diagnostic clue. Fever is typically absent.
No fever. Okay.
This helps distinguish salt toxicity from infectious causes of meningitis, for example, where you would absolutely expect to see a fever. So this lack of fever, it's a really important piece of the puzzle. Helps guide the diagnosis away from infections.
Okay, so the combination of a history of water issues, those specific neurological signs, the circling, the seizures, the blindness, and no fever, that starts to paint a strong picture.
A very strong picture, yes.
How do vets truly confirm this diagnosis, though? It sounds like it's a combination of that on-farm assessment and probably some lab work.
You're absolutely right. On the farm, a history of potential water deprivation, coupled with those characteristic neurological signs, is highly suggestive. And like you said, if you inspect the pen and find no wet feces or urine, that's another strong clue they haven't been drinking.
Makes sense.
For laboratory confirmation, vets look for significantly elevated sodium levels.
Yep.
Usually in the blood and also the cerebrospinal fluid, the CSF.
Okay.
And here's a key indicator, especially in cases where pigs have recently been rehydrated. The sodium levels in the CSF may actually be higher than those in the blood.
That's a very specific detail, almost like a forensic clue, tracing back the sequence of events.
It is. It really points towards that osmotic lag we talked about. Postmortem analysis of brain tissue showing elevated sodium concentrations, say over 2,000 parts per million, is considered definitive.
Okay, after the fact.
Yeah. When we examine affected animals after death, the gross lesions, what you see just by looking, might be few or subtle, maybe some stomach irritation or dry intestinal contents. But the most reliable method for confirmation is histopathology of the brain.
Looking under the microscope.
Exactly. Examining tissue under a microscope. The definitive lesion is this unique type of inflammation around the brain's blood vessels, with specific cells called eosinophils. It's usually there in the first 48 hours or so.
Pathognomonic, they call that, right? Specific to the disease.
Pretty much, yeah. In later stages, we might see the death of brain cells in specific layers, laminar necrosis. We'll also often see visible brain swelling. The brain tissue just looks flattened against the skull. And of course, general signs of dehydration like sunken eyes.
Gotcha.
Oh, and it's also worth testing the water supply itself sometimes, just to see if it has unusually high sodium, which could be a contributing factor, especially if access is also borderline.
Right. So why is differential diagnosis so important here? Given those really dramatic neurological signs, I imagine there are quite a few other nasty things that might look similar at first glance.
Precisely. Because the clinical signs are so distinctively neurological, salt toxicity must be carefully differentiated from other diseases that affect the brain. You've got to rule things out. Well, conditions like streptococcal meningitis, that's a bacterial infection, edema disease, which is caused by a specific E. coli toxin, causes swelling, but usually elsewhere too, even Ajewski's disease, pseudorabies, swine fever, Glasser's disease, they can all present with similar neurological symptoms.
Lots of possibility.
Yeah, and less common, but still possible, are poisonings from certain insecticides or phenylarsonics, other chemicals, even hypoglycemia, low blood sugar, especially in young piglets, or lead poisoning can mimic some of the signs.
So you really need those clues.
Absolutely. The diagnostic clues we discuss, like the history of water deprivation and especially that crucial absence of fever, are absolutely vital for veterinarians to distinguish salt toxicity from these other serious conditions.
Okay, so a clear diagnosis is vital. But once you have it, can you actually treat this effectively? What's the prognosis for a pig that's already showing those severe signs? You said mortality was high.
Yeah, the prognosis for pigs already showing severe neurological signs is unfortunately quite poor. Treatment is often unrewarding, honestly. Mortality rates, as I said, are high. It really raises that tough question. What can actually be done, and what are the real chances of success?
Right.
The absolute critical step in management, if you're going to try, is slow and controlled rehydration.
Wait, slow and controlled, not just opening the floodgates, giving them all the water they want. That really goes against instinct.
Absolutely not. And that's the counterintuitive part again, and often the fatal mistake that can actually worsen the outcome. Immediately providing unlimited access to fresh water to severely dehydrated pigs will rapidly worsen that cerebral edema, the brain swelling.
Because of that osmotic shift we talked about.
Exactly. It can be fatal. Water must be reintroduced gradually, very small amounts, frequently over a period of several days.
Several days.
Yes. This slow approach allows the sodium balance between the blood and the brain to normalize gently without causing that rapid rush of water into the brain cells.
How do you even do that practically on a farm? If you've got a whole group of affected animals, trying to give them tiny sips.
Yeah, it's challenging. Methods can include, for individuals, maybe dripping water slowly into the pig's mouth with a hose. For a group, sometimes using overhead sprinklers can work, allowing pigs to lick water slowly from the floor.
Okay.
Or, for herd-level rehydration, you might only partially fill water troughs and allow them to be drunk down completely before refilling after a set waiting period, just to prevent them from gulping down huge amounts at once.
Controlling the intake that way.
Right. For severely affected individual animals, a veterinarian might need to intervene with intravenous fluids. And crucially, it would be a slightly hypertonic saline solution, not just plain water, again, to gradually lower serum sodium levels without shocking the system.
Okay.
They might also use supportive care, like medications to control seizures, maybe drugs to try and reduce brain swelling.
Yeah.
But frankly, the odds aren't great once those severe signs appear.
So treatment is difficult, often unsuccessful, despite the best efforts.
Yeah.
What's truly the most effective approach for producers then, it sounds like?
Prevention. 100%. Prevention is by far the most effective strategy, and it relies entirely on diligent, constant water management.
Okay, so what does that look like day to day?
First and foremost, you must always ensure a constant supply of fresh, clean, and palatable water, always available. Make it a daily, non-negotiable routine to check that all waterers are functioning correctly, no blockages, adequate flow rates for the number of pigs in the pen.
Daily checks. Got it.
Being observant of drinking behavior is also key. A sudden decrease in water consumption, or like we said, pigs failing to eat, that can be the very first sign of a problem, even before any neurological signs appear.
Catch it early.
Exactly. If you are feeding diets with high salt ingredients for some reason, like whey, ensure supplemental fresh water is always available, no question. Also, make sure sick, lame, or otherwise compromised pigs can easily access water. They're at higher risk because they might not get up and move to the drinker as often.
Good point.
And finally, environmental management. Keep things cool and well ventilated in hot weather to reduce water loss. And obviously prevent frozen or clogged water lines in cold weather. These small daily checks, they are the true guardians against this condition.
Makes total sense. Prevention is everything here.
And just to quickly summarize the practical consequences, the economic impact of salt toxicity, it can be significant and swift. You've got high mortality rates, especially in outbreaks, so direct animal loss.
Yeah.
Surviving pigs often experience decreased productivity, poor growth, maybe lifelong neurological issues that hits profitability. And the treatment costs themselves, if you attempt at rehydration therapy, electrolytes, vet care, they add up, adding to the financial burden.
Right. Big picture impact. So we've taken a deep dive into swine salt toxicity, and what's abundantly clear is that this condition, often mistakenly just called salt poisoning, is primarily a critical issue of water deprivation. And crucially, it's made dramatically worse by rapid rehydration.
That's the core message.
We've covered the initial signs to watch for, those dramatic neurological progressions like circling and seizures, and that really non-intuitive diagnostic clue, the absence of fever. The bottom line is that prevention, through vigilant, proactive water management, is paramount. Because once those severe signs appear, the outlook is, well, pretty grim.
It really is.
So what does this all mean for you, the listener? You've now hopefully gained a deep, nuanced understanding of this complex condition, quickly absorbing the essential knowledge that could, quite literally, make all the difference for animal health and well-being on a farm.
Yeah, and if we connect this to the bigger picture, this whole situation really highlights how incredibly fundamental, seemingly simple elements like water can have profound and complex biological impacts, doesn't it?
It really does.
It raises an important question, I think. What other hidden dependencies or, counterintuitive reactions might exist in complex biological systems, animal or otherwise, that we perhaps unknowingly take for granted every day?
That's a great point.
Maybe consider how understanding these delicate balances, like the salt and water one here, can apply to other areas of animal health or even broader biological systems you encounter. What else are we maybe missing just because it seems simple on the surface?